Hi, tubers. I'm now 2 weeks post-surgery, so 2 weeks ago today, about this time I was being wheeled in. And um, it's been an interesting week. I've done a lot of reflection and a lot of things I think that I've thought up to have future video blogs about. But today I'm on my way to the dentist office. So this is going to be somewhat shorter. Um, all right, statistics, since people seem to go with that. Although I'll be vlogging about not, the scale isn't my thing. But at any rate, I lost 3 pounds in the last week, so this is week 2. I had lost 6 pounds the week after surgery and 10 pounds the week before surgery, so 19 during the last 3 weeks. And overall, since my highest weight was 278, so that, doing the math quickly, is 44 pounds, I believe, since I decided that enough already, I need to lose the weight. So I think the happiest thing, and like I say, the scale isn't really what I go by. The happiest thing for me this week was just how my clothes were completely. I went from wearing a 3X just this past Sunday. It was kind of like the last hurrah for a pair of pants that I like, but they were kind of falling off of me. But getting squarely into a 1X and extra large sizes. So it's been a while since I've seen some of those clothes that have been in my closet, and being able to get them on was great. The other thing that's kind of funny is my husband keeps coming along behind me and pinching me, Italian style, but he's third generation Okinawan, so can't say that it's because he's Italian. Anyway, he keeps saying things like, "You're hot." Just really kind of funny. It's endearing, given that especially he was literally half my size, half my weight when I started this journey. So I just never expected him to really look at me as hot. I think I always thought of the attraction as on other levels, and not so much the physical. But he's always let me know that he thinks I'm beautiful, which is awesome, even at the higher weights. Um, but now he's really taking notice, so that's kind of funny. Um, and sweet, what can I say? I enjoyed shopping this week. I hadn't planned on buying clothes, but this was kind of a little different thing in that these were exercise clothes that I felt like I could really feel good in. I have workout clothes from years ago that I'm back into wearing, but they're kind of limited, and they are several years old. And this was my treat to myself. Given that they're spandex, I think that I can be in them for quite a while. But you put on top of that a Kohl's sale that brought the price down really reasonably. It was 40% off to begin with, and I had a 20% off coupon on top of that. Then I had another coupon for $10 free, so what the heck, I went for it, got myself some new exercise clothes. So that was awesome. The other thing that I did this week was I hit the physical therapy pretty hard. Well, let me back up a little bit and say that my first surgeon visit post-op was actually yesterday. Because of scheduling, they weren't able to fit me in the first week post-op, so I was nearly 2 weeks post-op to see him for the first time, and he looked at my incisions and gave me the all clear for being able to go in the pool within 2 days, which I'm thrilled about because that's where I can get some real good work done without hurting my joints. and really toning up the muscles. I mean, to me, it's all about feeling healthy, being active again, toning up the muscles as I go along. I have a real fear of loose skin, and looking saggy, but being 58 years old, and I think, can't help that I'm going to have some of that anyway. But boy, if I can minimize it, I sure am heck going to try to do it. So anyway, the surgeon gave me that clear, and he also said, still gave me restrictions for working with weights more than 10 pounds for another couple of weeks. And not be so vigorous in any kind of exercise that I would be stretching on the incisions, but gave me clearance for doing anything with TheraBands within the physical therapy realm, and then I could be in the pool, as I said. So I did go to physical therapy yesterday. Well, I've been going, actually that was my third visit post-op yesterday. And I had been going to physical therapy before my surgery for various reasons, having to do with my neck and shoulders and hips mainly. That's another story how I got into that. But in working on the core in general, but everything that I'm doing then and now is really benefiting me for doing the toning that I was talking about. Yesterday, however, they kicked my butt. I was there 2.5 hours. An hour of that was purely working on deep breathing, which benefits your core, and that's worth a whole vlog all by itself. I did what really wasn't supposed to be cardio so much. Hardcore cardio is a warm-up, but for me it ended up being cardio, and I think that I just did too much of it. The recumbent bike that I cooled down on, that was fine, and the arm cycle at the beginning, that was fine, no problem. And the treadmill walking, and I only get up to like 2.5 miles per hour tops. That was fine. But what kicked my butt was the elliptical. So I was doing circuit training and with the TheraBands, both legs and arms, and that part's fine. But part of the circuit was, and I only did it once because it killed me, was the elliptical. I had 5 minutes on the elliptical, and maybe because it was towards the end of my workout. Oh my gosh. I think what I'm noticing big time is that I can't expect to go into any kind of situation where I'm going to be doing this kind of work and be underfueled. And we're almost out of necessity underfueled. I mean, it's kind of the name of the game here. We have so few calories going in at this point. And prior to this 2.5 hour session, I had maybe 250, 300 calories tops. And I think the other issue, of course, is going to be hydration. I really tried to push the liquids all throughout this time period, but I think where I was just completely losing it on the elliptical was I had nothing left for my muscles to give, and I believe that was a fuel issue. So in the future, I'm going to be taking more in before I go and bringing along with me some protein drinks to have right there. So it kicked my tail. I'm sure that there's a huge benefit from it. I can tell from the way my clothes fit and the way I feel when I'm not exhausted the next day from doing this physical therapy. So I know in the long run I'm going to be really happy that I'm doing. I am happy. I shouldn't even say going to be. I'm just particularly tired at this moment. So I said this was going to be a short video, and it's not so short, and it's time for me to run along to my dental appointment, and I'm making faces only because the last time I went in to hopefully finish up the crown on my tooth, they uncovered an issue in my mouth which led to oral surgery, which led to discovery of a massive infection in my jawbone, which led to being in hospital 8 days, which led to being on IV antibiotics for a month, oral antibiotics for an additional 2 months. Not a great time, and all of that delayed my bariatric surgery, but more to the point, it just was not a great time. So yeah, I'm a little more than usual concerned about going to my dental, although I've gotten all clear of good health from everywhere else, so it should be just fine. So off I go. I've done enough procrastinating. Take care. Talk to you later. Bye.